Dr. Tim, you have experience in healthcare. Can lean save our healthcare system?
I think lean is the only thing that can save the healthcare system, whether it's in the UK, whether it's in Ireland, whether it's in Canada, because cuts don't cut it anymore. And now we're at the range where we're making cuts such that we're threatening people's lives and their welfare. So if you need to have so many nurses per station for so many beds, then that's it. So it's really a question of utilization versus capacity. Are the nurses using the time to the best of their capacity? Or, like any process, is there waste? Is there downtime? Are there other things that are preventing them from using them to the best of their capacity? I'll give you an example. One study we did, we found that nurses were spending 2 hours a day looking for medicines. So we found a way to reduce that, to eliminate that. So now they had 2 hours of found time a day. So now they can do their charting on time. They were doing more patient-facing procedures on time. They were being there more often in a mindful way to take care of their patients.
But one response there to earlier was, how on earth can you deploy lean in an environment like healthcare, like government, when the whole organisation is stovepiped and it's full of silos? So, like, how can you achieve the results that you're talking about if your whole organisation is built or structured like that?
So one of the things I like to do anyway, I don't know what your feelings are, but one of the things that I like to do is do a value stream map. And a value stream map is a frequent tool that Lean uses. So whenever you've got silos, the value stream map gets people from all those different silos, it gets them in together. And they watch typically the patient flow from the beginning to the end. Now, when I do a value stream map, I usually get two big aha experiences. The first aha is when they discover how much work has gone on to get the patient to them. And the second big aha is when they add up all of their value add time, the time when something's being done with the patient, versus the non-value add time, which is all the time the patient's sitting there waiting. And the value add to non-value add ratio causes people to say, wow. Because for one example we did, 7.5 hours it took the procedure to be done. The actual value add time was 20 minutes.
So it helps you to identify the waste.
It helps us to identify the waste, the constraints, the bottlenecks, the back and forth of the patient or the information. And that gives us something to zero in on to reduce.